welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to talk about breakthrough for Artemis SCID patients in the form of infant gene therapy. 10 young children born without functioning immune systems and lacking the ability to fight infections are on track for healthier lives thanks to a new gene therapy treatment, reports a recent study in New England Journal of Medicine. The children have Artemis SCID, a very rare genetic disorder that is typically treated with a bone marrow transplant from a healthy donor, ideally a matched brother or sister. The new gene therapy allows researchers to treat newly diagnosed babies with their own cells, adding a healthy copy of the Artemis gene to the baby's harvested marrow stem cells, then infusing the corrected stem cells back into their bodies in hopes of avoiding many of the short and long-term complications of the standard treatment, including death. Laverna Shorty, a grandmother and caregiver of the first child to enroll in the clinical trial, as an infant in 2018 has seen her grandson HT go through a lot of pain in his first years. HT's condition was discovered shortly after his birth in Arizona and he was airlifted to UCSF for treatment. The first outcome of phase 1 and 2 trial involved the safe transfusion of gene-corrected cells that would differentiate into white blood cells by 42 days after infusion. Researchers theorized patients would need less chemotherapy to prepare their marrow for transfusion when their own cells were being used. Thus, only 25% of a full dose of busulfan was administered. The second outcome was T-cell reconstitution at 12 months, a measurement of the strength of the immune system. All 10 patients were safely transfused with their own gene-corrected stem cells that gave rise to corrected peripheral blood cells within 42 days. All 10 were growing their own T cells and B cells by 12 weeks, and 4 of 9 achieved full T cell immune reconstitution by 12 months. 4 of 9 also achieved full B cell immunity by 24 months, allowing them to discontinue immunoglobulin replacement and receive standard childhood vaccinations. An additional 3 patients who were followed for fewer than 24 months had promising B cell development when compared to previous outcomes for donor transplanted patients. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.